Okay, Dr. Noshevan, are you ready?
Yes, I'm ready.
All right, let me start a timer for you. Okay, your time starts now.
Yes, I am Dr. Noshirwan, one of the doctor in this clinic. Am I speaking to Ms. Iqbal, 21 years old?
Doctor, I am Mr. John, 21 years old.
Yes, sorry. Yes, Mr. John, 20 years old.
Yes.
Yes, okay. Uh, I hope you haven't been waiting so for too long for me in this room. And the purpose of our today's consultation is to discuss the issues related to your health. Is it all right to go ahead?
Okay, doctor.
Do you want your other family members to attend this consultation, or do you want it privately?
It's okay, doctor.
Yes, okay. Please initially tell us that how are you feeling right now after admission to the hospital last night?
I'm fine, doctor.
Yes, okay. And how much do you know uh, and what has been happening so far here?
Actually, doctor, I am just fine. I just want to go home.
Yes, okay. Okay. Uh, I want to explain you more about your health condition, what has been happening to you. It is okay?
Okay.
Yes, okay. Last night, you were admitted to the hospital in unconscious state. Our medical team uh, did all the necessary investigations, and also uh, we found that you had taken some uh, drugs.
Hmm.
Uh, if you remember exactly which drug have you taken?
Actually, doctor, I took paracetamol.
Okay. And how much paracetamol have you taken?
10 tablets
10 tablets. Have you taken all these tablets at once or a separate time?
at once.
At once, okay. And after taking all these tablets, have you informed someone else from your family members or your friends?
No, doctor.
Okay. And in addition to 10 tablets of paracetamol, have you taken some other medications with this paracetamol or not?
No.
No. Okay. Uh, I want to ask some other questions. Uh, do you have any problem with your mood?
Yes, doctor. I'm always in a
Okay.
low mood.
Uh, Low mood. Okay. And any problem with your sleep?
Yes, I am mostly sleepless in most of the nights.
Yes, I understand your concern. So we are here to help you, provide you all the necessary support that you want. And also, are you financially affordable that you can afford your all daily necessities?
Sorry, doctor, what?
Uh, an economic problem, financial problem.
No.
Okay. And do you have any problem in your workplace?
No, doctor, I am a student.
Yes, yes. I'm very, very sorry for telling you
Dr. Noshevan, your voice is breaking.
yes, okay. I just ask you, do you have any problem within your family? I'm sorry for telling you, because for getting information from our patients, we always ask such questions from our patients.
No problem, doctor.
Yes, okay. Uh, that is good news that you are now okay and your health is good. And so, paracetamol is a drug in overdosage will lead to damage to the liver, and also it may cause some damage to the kidneys. And therefore, here is a need. We advise you to stay in the hospital because so far the level of the paracetamol hasn't been determined. We already said the result. We are so far waiting to the result, and therefore to stay to the hospital until completion of the result of the investigation. It is for your distress to stay in the hospital.
But doctor, your nursing staff was telling that my tests have came out to be normal. Then why you are not sending me home?
Yes, so far we haven't received the result of your test. And once we receive the result of our test, and then after with consultation with our consultant and senior doctors, we will decide either you are eligible to be discharged from the hospital or not. But so far, we advise you it is for your best interest to stay to the hospital. And I want to ask you, why do you want to leave from the hospital? Is here any reasons that you want to leave from the hospital besides you are feeling okay right now?
Actually, doctor, I don't want to live here. But just give me a llama paper and I just want to sign it.
Uh, yes, okay. We understand this concern. Again, I emphasize you that if you stay in the hospital, it is for your best interest. We will regularly monitor you. We will check your all test results. And so, if you want to leave the hospital, so we are going to give you the DAMA paper, the discharge against the medical advice. You can sign it, and we can tell you that after leaving the hospital, if you encounter any medical problem, I am very, very sorry for telling you, you will take the full responsibility of such events. And also, I can tell you, even if you sign a LAMA paper, and if you again want to come back to the hospital, we are here to admit you and provide you all the necessary support.
Okay, doctor.
Do you have other questions and concerns?
No.
Okay. And if you don't have any other question and concern, we will provide you some information, some brochures, some leaflets regarding the paracetamol over dosage. And also, we will provide you some address of supportive websites. And also, as you have been have some problem with your mood, so it is advisable that we refer you to a mood doctor to evaluate you further and treat you accordingly. Is it okay that we refer you to the mood doctor before you leaving the hospital?
Okay, doctor. 1 minute and 30 seconds are left.
Yes, okay. And I want to ask you some other questions. I don't take privately. Uh, do you use alcohol,
No.
smoking,
No.
any party drugs?
No.
Yes, okay. You mentioned that you are a student. Have the recent symptoms, symptoms of your mood affected your studies, your lessons, or not?
Yes, they are affecting.
Uh, how much they affected your lessons, your daily activities?
Yes, doctor, they have affected a lot.
Okay, okay. We understand you. This is will be a difficult time for you. Your mood is low, and this low mood affected your daily activities and your uh, lessons. So again, uh, before leaving the hospital, we will refer you to the mood specialist or a mood doctor, and he will help you a lot to improve your mood condition.
Okay, doctor.
Okay. Do you have
Time is
other
almost
concerns?
time is almost over.
Okay.
Okay, Dr. Noshavan, just wait. And meanwhile, I
Mm.
will give you your feedback.
Yes, okay.
Okay, doctor, your feedback is almost ready.
Mm.
Just a couple of seconds.
Mm.
You can check it in the group.
Yes, okay.
So let's
Mm.
start discussing basic communication
Yes,
again.
okay.
Uh, actually there are two things. This
Mm.
paracetamol poisoning scenario was quite common in the last year as well as in this January diet. It has come
Mm.
multiple times. It has come in two ways. In one way, it has come with suicide. In another way, it has come by mistake. That the patient,
Mm.
by mistake, instead of taking antibiotic, she took the overdose of paracetamol, and now she has come with raised levels or with normal levels. So here it was with suicide, and the
Mm.
proper thing was mentioned that the patient's room was locked and a suicidal note was there. So here you have two things to perform. First, I
Mm.
would say that whenever the patient has such thing of suicide, or it is a scenario of some, uh, I mean, intentional drug overdose. When you start, okay, you will start with greeting, good hello, good morning, or hello, good evening, according to the time of your exam. Then you will introduce. In introduction, whenever you get the paper outside, your foremost thing is to write the name of the patient and surrogate and his age as well, because you have to check both things in the start after your introduction. Then you will build some repo, you will say some good sentence, then you will set the agenda. For example, here you set the agenda that I want to speak to you regarding your health condition. Just give me a
Mm.
second.
Mm.
Okay. Then after that, you will say in such a suicidal scenario, you will say that whatever we will talk about today will be kept confidential and it will be
mm,
only between you and me. So
mm,
whatever you want to speak about your health condition, you can share with me. Okay,
mm,
it will build some trust because such things only come if it is a scenario of suicide or if it is a something like HIV counseling or if you
mm,
any communication scenario with HIV, whether you have to take the consent for HIV testing or you have to tell about that possible positive finding of HIV. In such cases, when you start, you will say this sentence that whatever you want to tell me will be kept confidential and uh, it will be only between you and me. All right. And one thing more, yes, it is a very good thing that you know that only cases of communication in which you can take the history from the surrogate, actually from the patient, is the
mm,
cases of depression. Here, because most of the cases in the exam scenario, the surrogate with depression will not speak much. So
mm,
here you have to
mm,
ask some open-ended question. It was good you asked quite few questions. You started here that okay, uh, how are you feeling today? How is your mood? Or you can also say that what do you do for living? He will say okay, I'm a
mm,
student or I do some this work. Then you can ask that what do you do for your fun or in your free timings, any activities or any hobbies, just to involve
mm,
him. Then you can also say that do you stay at home more often or do you have friends and you share time with your friends as well? Because
mm,
one thing here I want to tell you is that try not to confront the patient when he is coming with
mm,
suicide. Instead of
mm,
you yourself telling that okay, I have read your notes, because some candidates also perform like this that okay, I have read from your notes that you have come with paracetamol overdose or you have come with insulin overdose. This is somewhat
mm,
called as confrontation with the patient, and some PACES examiners don't like this. You should come with such approach that the patient himself will tell you that yes doctor, I have done this, and there are such approach available, and this
mm,
approach will give you full marks in your communication. For example, here you are just building your ground, you are building rapport with the patient. You will say it is very good you ask about sleep, you can ask about appetite. Similarly, you can ask about do you still enjoy the activities which give you pleasure or which give you some enjoyment before.
mm,
uh, in this way he will just open up. Or for example, the examiners have told the surrogate that no, you will just become the acting of gloomy and don't give much information to the candidate, no? Even
mm,
then you will be assessed quite in the examiner that you are a good candidate if you come with this approach. Then you will
mm,
start that okay, can you please tell me that what happened last night. I mean, just give 1 to 2 minutes in your those sentences which I just told you, na, that what do you do for living, do
mm,
you still enjoy the activities, and then you will, instead of telling yourself, just ask from him
mm,
that what happened last night. It might be a
mm,
possibility that he will say nothing happened, or he will
mm,
tell you that I just took
mm,
some tablets for my headache, or anything which the examiners have told him, na. Then you
mm,
can ask, then again you will say that okay, Mr. John, I am not trying to be judgmental, I just want to help you and I really want to do so. Okay, so if you come like this, it might be a possibility he will tell you. Okay, then you can say that again you can say here that whatever you will tell me will be kept confidential, it will be between you and me. Again you are saying this, no? So he will tell you
mm.
that yes doctor, I took some tablets. Then again, you
Okay.
performed well. You asked how many tablets. You asked what you take along with those tablets. You take them at once or only one by one. Similarly, if it is paracetamol, you can ask, for example, if you took them with water or something else. For example, alcohol, it will double the,
Mm,
I mean, dangerous effects of paracetamol. Na? And then you will again ask that did you perform it intentionally or did you have a plan of doing so? And ever have you done this before as well? Then you will ask, okay,
mm,
it was written in the scenario that he locked the room, he had a suicidal note. Still, you will ask that did you lock the room, or did you write a
mm,
letter for someone, or did you inform anyone? Yes, you asked about the information that did you inform before or after. You will
mm,
ask both, now that before doing this act,
mm,
maybe he has told some friend, or even after, maybe he has told someone. So again you will keep
mm,
on checking. Here you will not check the understanding. Now you will keep on telling him that don't get embarrassed, or don't, I'm not trying to be judgmental, I am only here to
mm,
help you. And let me tell you one thing, that it can happen to anybody.
mm,
So don't get embarrassed, and I just want to help you out, and we will be with you in this difficult time, and we will provide you all the possible support that we can. Okay. And you can
yeah,
also say meanwhile that I can see that you are in quite a stressful condition. Okay, just a
mm,
few sentences of empathy, then you will ask what happened after that. Now, who brought you to the hospital? For example, if the surrogate will tell you that no, I came myself, then it might give you a chance that okay, the patient still wants to live, and he still has the capacity left. But
mm,
here, if he say that okay, my friends broke inside the room, or my parents came and they brought me in the hospital. And one thing more I remember here, that in the scenario it was not mentioned that the patient is unconscious. So whatever
mm,
information is given in the scenario, only tell those things, na? Because it might be a chance that he is unconscious or not conscious. So you will not assume it yourself. All right. And one thing more here I want to tell you is that whenever a patient commits suicide, he loses the capacity. Once he
mm,
loses the capacity, he cannot sign the lama dama paper now, and he cannot even ask for that. And since it is a case of suicide along with paracetamol poisoning, both things side by side, so here he must be assessed by the mood doctor. Instead of just
mm,
giving the advice, he must see the mood doctor within 72 hours of his hospital admission, according to the UK law and their rules and regulations. So here you will not advise the patient to go home. Yes, it is good thing that you ask why he go home, because when it comes only with paracetamol overdosage, which is because of mistake, then there might be some concerns that patient want to go home because of some function in his family, or because the hospital environment is not getting suited. That is something different. Those concerns are
mm,
different. They are answered and managed according to the scenario. But here
mm,
patient does not have the capacity. So you
mm,
will see that you will not say that I can give you the lama paper and you will sign and you will come again if you feel any side effect. Because yes, here his liver can be affected, and his mind has already affected. So here you have two tasks basically. And likewise, for
mm,
example, if the if by applying the first approach which I just told you, that still the patient does not tell you that he has done such paracetamol overdosage, you can also say like this, that I can see while talking to you that you are not feeling good, and I can see that there might be some sort of stress going on in your life. You can share with me
mm,
because I am here to help you. Okay, so if
mm,
you come with these sentences, it might be 99% chance that the surrogate will tell you now. And the examiners will also like this approach, that instead of you telling the surrogate that you have done poisoning or you have done some suicide attempt, the surrogate himself is telling you. So it will leave a very good impression on the examiner. All right. Similarly, for example, if it is a overdose of paracetamol, likewise, it can come, this suicide can come with the insulin overdosage. That is also a very common scenario, that there might be a nurse, or there might be some patient, the relative of a diabetic patient. He can come with insulin overdose or sulfonylurea overdose, and he can come with hypoglycemia. Even then, you can apply the same approach, that instead of you telling the patient that you have done insulin overdosage, he will say, no, no, I have not done. You will then say, okay, it has come in your result. Again, the surrogate will say, oh my god, matlab, I mean, just want to tell you that this will uh, mislead the communication. Instead, you can come with this approach that I can see that there might be some sort of stress going on in your life, and whatever you will tell me will be kept confidential. And if you want to disclose, then he will tell you, no? That yes, I have done the paracetamol overdosage or insulin or something like that. Here, I again want to tell you that whenever it is a case of overdose, you should ask that where is the source, from where the patient took the paracetamol tablets, or from where the patient took the insulin. For example, just don't assume it yourself that the patient is a nurse, that's why he has the excess, or the patient is the relative of some diabetic patient or something like that. Always ask that where you took these tablets. He might tell you that I took it from a pharmacy or from my GP or from my doctor, or they were present in the home. All right. And then you will again say that okay, then coming towards the paracetamol, that if it is mentioned in the scenario that paracetamol levels are sent or they are normal, then you can say that the raised paracetamol levels can be quite dangerous down the lane. And sometimes what happens is that the paracetamol levels don't come out high in the initial few hours, and they can come out high quite late, and you don't even realize unless the damage has occurred to your liver. So that's why we want to keep you in our hospital, because here they want to keep the patient hospital because of two things: paracetamol levels monitoring, observation, and secondly, the most important is suicide. So basically what happened here is that I just wanted to share both of these cases in one case. It can come with in one case as well, no? So again, if it doesn't come with suicide, then you will pay more emphasis on these paracetamol levels. That, for example, it may be mentioned in the scenario that the patient has been given an acetylcysteine, because this scenario has come in multiple ways in the previous diet. One scenario I was reading that it came that patient has already took an acetylcysteine by the hospital staff, and now the third dose is going on, and she wants to get discharged, and still the paracetamol levels are high. Then again you will counsel her according to that scenario, that you will ask that yes, despite giving you the, I mean, we have given you the treatment and in the injection form, and you show much improvement, but still we recommend that please complete your treatment before your discharge, so that you are in safe zone. Again, she will have some concern that why she don't want to hospital, but that is a I mean, normal things, no? For example, in those cases the concern might be that I don't want to live in your hospital because your hospital bed sheets are not clean, or there is lot of noise in your hospital. In those cases you can answer those concerns. Okay, one thing I want to mention here, Dr. Nushirwan, that whenever there is a concern, always start answering the concern by I appreciate your concern, because this thing is written in your mark sheet, that whether the candidate has appreciated the concern or not. So try to start that yes, I appreciate your concern. I will speak to the ward manager and the concerned staff uh, uh, regarding the cleanliness of the ward, and also we can shift you to some isolated place, and we will try to sort out your issue if it is some issue regarding the hospital. Or for example, if there is some issue that the candidate, because the surrogate has concerns given by the examiner. For example, she has the concern that my kids are alone at home and there is nobody to take care of them. Again, you can say that okay, I can see it is very difficult for you, I appreciate your concern, and we have social health team, we have mobile health team available in our hospital, and immediately after this meeting I will uh, uh, contact them, and they will help you in this regard. And we have social support available, and there might be a chance that we will arrange a meeting of your kids with you in the hospital settings. Okay, so those are the different scenarios that this paracetamol poisoning has come quite frequently in the last year, and even in the recent diet as well. Okay, and then you can again assess the capacity of the patient by asking more questions. For example, in this case, that Are you still planning to do this again, or do you still
mm,
want to take your life? Okay. It might be a possibility that he's behaving like more depressed patient. He might not answer you. Still, the examiner
mm,
will realize that the candidate is checking the capacity of the patient again and again. And similarly, you can ask such questions in a suicide case that has anyone else tried in your family to attempt such thing? Or, for example, if he say yes, then you can ask that who was that, and was he successful? And again, you will keep on saying that I'm so sorry for that, and things like that. Okay. And
mm, okay.
similarly, for example, when the patient was again and again saying that I want to go home, please give me some lama paper. Again, you can say that your current situation is really worrying me, and I am afraid that you may risk yourself again. So I'm so sorry to inform you that unfortunately you are not allowed to go home unless and until a mood doctor will assess you, and we will make sure that he will assess you as soon as possible, and he will have a better plan for you, and they will definitely help you in this regard. And I can see that you are in quite a distressful condition and you need the help, and we are here to provide you the help. And similarly, if for example there might be a sentence that you can even say that legally you are not allowed to go home, and I'm so sorry that I don't want to use this word of legally that you are not allowed. Okay, only on those cases
Mm,
if if for example you have told everything and still your time is left. And
mm,
similarly, you will keep on asking about concern, but in such cases of depression, there might not be any concern. So you have to speak
mm,
more yourself than the patient.
mm,
So this was about this
okay.
scenario. Any question?
You mean that all the suicide cases are considered mentally incapable?
Yes.
Mm,
Patient loses
okay,
the
okay, okay.
capacity, and whenever he
Mm,
comes with suicide, he is not allowed to go back unless and until he is
yeah,
evaluated by the psychiatrist or and the whole psychiatry team.
okay, understand. Okay.
Mhm. And one thing more, I'm not sure I have told you this, that whenever you are performing a communication scenario, uh, we often use this term I understand. So
Mm,
I would suggest that I have seen for certain feedback of some candidates, because you know when you attempt the exam after your result, in the next few weeks they give you feedback sheets. They are the same sheets which you filled in your exam, and they are written. I mean, the examiner have written them themselves, and they will send you the picture of those mark sheets. There they have written that. In inverted commas they have written I understand. And then they will written that the candidate used this word quite frequently, and
mm,
they have lost marks, 1 or 2 marks, because what they want is that you, instead of using this word, you can see that you can say that I can see it is very difficult for you, because it is our habit that we use this word I understand. But I would suggest that you can use this word I can see that it is very difficult for
mm,
you, because you can only understand once you undergo that process, or once you
mm,
are in that patient's shoes. Only then you can understand, otherwise you can just see.
mm,
Okay. So
mm.
any question?
No any
If
question
there is,
from my side.